Embu-Guaçu, a small town in the state of São Paulo, a poor rural area in Brazil. Following the departure of the Cuban doctors, its 68,000 inhabitants lost 16 of the 18 doctors who practiced in the city's public clinics. Since then, this health centre only sees its patients once a week, on Friday.
Maria da Glória.
Even before his election, Brazil's far-right president had repeatedly criticised Cuban participation in the More Doctors scheme. In response, the communist island withdrew its citizens from the programme. So doctors like Eduardo have to work on their rare days off to attend the most urgent cases, like that of Susie.
These political disagreements mean the Brazilians are the prime victims with no medical follow-up. Our government has tried to pretend that these doctors will be replaced by Brazilian doctors, but they do not want to fill those positions, so these areas remain without medical coverage.
Dr. Silva is now caring for 8,000 patients, an impossible task. With such an overload of work, the nurse at this clinic is now in charge of prioritising cases.
Medical appointments are reserved for the most urgent cases. Aren't they, doctor? Priority is given to urgent prescription renewals, examinations that have already been delayed, high-risk pregnancies, children who are at risk of death. Those are the ones we treat as priorities.
28 million Brazilians find themselves without medical assistance. Free access to healthcare is a right in Brazil, and the More Doctors programme proved its worth here over the course of 5 years. Susie and her husband suffer from chronic diseases. For 4 years they were treated by the same Cuban doctor, but since her departure, due to a lack of regular follow-up, their treatment has been discontinued.
When you have health issues, you have no choice but to wait for the day the doctor is there. But on that given day, the doctor is systematically busy with other patients. So we have to wait for an appointment that will most certainly be with another doctor. In most cases, not the same one that saw me before.
Despite the order of the doctors to return to Cuba, a quarter of them made the choice to stay in Brazil. Like Carol Sanchez, firmly opposed to the Cuban regime. He practiced for almost 2 years in northern Brazil. He was paid €600 a month, enough to help his 2 children, who remained in Cuba.
This is the document that was given to me when my mission ended.
At the beginning of July, the government promised to reinstate those Cuban doctors who remained in Brazil. But Carel doesn't believe in it anymore.
Bolsonaro promised us that we could work. He promised us political asylum, his land as a refuge, that we would have the opportunity to live here in Brazil. But for 8 months, nothing has changed. We have no work, no stable situation.
He stayed in Brazil in the hope of continuing to practice medicine. But he finally gave up and now lives in São Paulo, where he's looking for work. Today he's attending a recruitment session organised by an NGO to help integrate refugees and asylum seekers. After 2 hours of waiting, Carel manages to pass an interview to work as a painter in front of a panel of 4 people.
So were you part of the More Doctors program?
Yes. But that's it. Now I'm a normal guy looking for work. And I'm not afraid to work. I can do anything.
Today, Carel's medical degree is of no use to him. Instead, it's his precarious status as a refugee claimant that will enable him to obtain work.
It's sad. We have a lot of professionals who are willing to work in these remote areas, but we end up having to look for work that has nothing to do with our degrees. At least this painting job is something.
If Bolsonaro does not keep his promises, Carel will try to be part of an identical programme, this time in the United States. Meanwhile, the government reopened the programme, but only to Brazilian doctors. And so far, just 1,500 have responded to the call. More than 7,000 positions remain vacant.